cannot get at the podium without talking about the need in Northwest Arkansas, so I want to go through first how we identified the need to apply for the CMS grant, the CHIPRA grant that was out there, and why, some of the role the clinic plays itself in being the access point for the recipients for ARKids. So I just would be remiss if I didn't share that with y'all. So I want to start off by talking about the clinic and then drawing a picture of the community before I go into the activities that we do. We are a community health center. Our mission is to serve as a medical home for low-income and uninsured neighbors in Northwest Arkansas. We provide services regardless of ability to pay. We are not a free clinic. We are not a ready clinic. If you do not have insurance, we offer the sliding fee discount based on federal poverty level and your household income. We do accept ARKids and Medicaid, and I'm going to move on. There's two more. I'm sorry, I'm moving fast. I do this too. We have 5 locations in Northwest Arkansas. We have a medical clinic in Siloam Springs, which is in Benton County, one in Rogers, and one in Springdale. And then we have a dental clinic in Springdale and Rogers. And the importance for that is in those two communities, Springdale and Rogers, specifically this was 2005 census data, about 33 to 35% of the population there are Latino. So because of that, we end up being an access point for a great deal of the Latino and Marshallese community because we are embedded in the community in which we serve. I think we're at 55% of our staff are bilingual, from the service of the front desk all the way back to our medical providers and our APNs. I'll back up one little class. That's okay. We, about 88% of those who do access services with us live below the federal poverty level. 32 are uninsured, 53 are Medicaid recipients. We have a large prenatal program as well, so we enroll people through Medicaid there. But most importantly, 60% of the almost 19,000 patients we saw in 2009 were children. 53,000 times our doors swung open and shut with people accessing services there. The next slide will show from 2005, a year after we became a federally qualified health center, you can see to where we were in 2009 as far as the patients that access our services with us. Our patient satisfaction surveys show that 98% of people who hear about the clinic is through family and friends. So we have a very small marketing department. We don't have any problem explaining to anybody in the community that services are available. But we do constantly evaluate the need in the area, and this is our latest data on free and reduced lunch. Northwest Arkansas is often thought of as being paved in gold because we are the Golden Triangle and we have all of the goodies there. But what has happened in our area, and I'm probably preaching to the choir, but I'm going to say it anyway, is that the haves and have-nots are a huge disparity. When we grew so quickly during all the development that took place, people moved into the area and took service jobs. They took construction jobs, they took hospitality jobs, and then the boom left. And there are people that have very low income wages compared to a higher income level lifestyle in that community. And that has created an enormous economic disparity. So as you can see in Rogers, one of our largest school systems in Arkansas, 58% of the children on free and reduced lunch. Springdale, 62%, that's home of Tyson. Let me reiterate that. And Decatur and Lincoln and all the other schools there, even higher numbers. We have about 93,000 people in Northwest Arkansas are uninsured. About 7,000 children are enrolled in ARKids in Northwest Arkansas but do not have access to a primary care physician. And that is simply because they've capped out. We have a health professional shortage that is enormous. I think that HRSA last put it at 4,999 to 1 physicians to patients in the area. So I just did my data, that's why I know that. That's just not in my head all the time, but we're getting ready to apply for a grant. But so we have kids who have been enrolled, they are signed up, and no one will accept them. And community clinic happens to be obviously turning a no one away regardless of ability to pay, so we are the open enrollment place for kids to access services. And then, of course, the new math is much better than the anecdotal data I have here that Elizabeth and I worked on, but we think that there was about 10,000 uninsured children in Northwest Arkansas. For with about 7,900 of those qualified but not enrolled. So, again, preaching to the choir, what is the problem? We have scarce resources, we don't have enough providers to take full care of, because we have an immigrant population that generally works in our poultry industry. We don't have offices that are open during flexible hours where everybody can get offline, take their child to the doctor. The clinic actually has evening hours. Few healthcare providers, language barriers, and all of that creates enormous health disparities for our Northwest Arkansas area. As a community health center, we hope to be a medical home. We're going to ask some other pieces that are important outside of getting children enrolled, is those families that are enrolled in ARKids don't just take their child in when they're ill. We really want those families and parents to come in for their EPSDT. We want those children to get vision and hearing. So we reach out way beyond just getting enrolled. We have to educate on what services are available to those families through ARKids. Am I moving too fast? Okay, I'll do that. Awesome. Okay, so the other things that we provide are primary care, chronic disease management, diabetes and nutrition education, prescription assistance. We also have a huge oral health program, a dental program. We did identify just recently that our ARKids Peds patients over in our medical clinics, about only 1/4 of them were going to our dental clinics. So there's a new challenge for us, identifying a need. Why are they going for peds and for their medical needs, but why are they not taking those same children who have our kids to our dental clinics to get the preventive care and all the fluoride treatments they need there as well? Like I said, we provide the whole pediatric gamut. We see prenatal patients through the 28th week of pregnancy. We enroll them on site to get enrolled in Medicaid so they have a payer source. Then we partner with the local OBGYN community. All in the area are willing to partner with us because they don't want to see any woman show up for delivery without prenatal care. No, go forward. Okay. We also have patient services. We are very fortunate to have patient advocates at each site, which help any patient navigate the services. We have patient eligibility workers who also can enroll these families on site and give them the services they need. That is where we catch our renewal issues, but not all of them. Generally, when a child comes in, we're able to see where they are, and if we need to get them their application renewed, we're able to do it there on site. Just recently, we provided a behavioral health component, which is really an integrated behavioral health model. We don't take community members in for behavioral health. It's an integrated model where one of our physicians flags someone with behavioral health needs, someone on the clinic can come in, and that works for our children as well. So if you're an established patient and a physician identifies a need out beyond the physical, then one of our behavioralists can go into the office with the patient. So, I'm going to talk a little bit about our program now. Washington County has about, population size is about 409,000. We identified that probably one of the reasons why the gap is so huge there with kids enrolled is that people aren't aware that they are eligible for ARKids in Northwest Arkansas. And then the newly uninsured from the drop in the economy there, people being eligible but not really realizing it again. And then the Latino and community Marshallese members who are just not educated on the services that our kids have. We, before I go kind of jump ahead a little bit, when we were interviewing our outstation eligible, we call them promotores in Northwest Arkansas. These are lay community members who go into the community to do the outreach services. We did not pull any of our case managers in. We actually wanted peer community members to go into the community and be able to speak one-on-one about the need. But through that process, they identified to us that most people in the Latino community, in Northwest Arkansas at least, did not understand the yearly wage as far as the scale of eligibility. Like really, we've only printed 50,000 pieces of education material getting ready to go out because there was a big cultural competency problem we had. The wage was better understood by what they take home weekly or monthly. And so we're revisiting immediately how we're going to reach out and explain to people in the community how they are eligible. And then we also, like I said, we're educating people on the services that are available through ARKids, not just having them come in for sick child care. So what we decided to do was we hired 3 staff members 2 who are the community peer outreach folks, and then we have 1 full-time staff who really manages the grant and coordinates the programs. But we're doing pretty much the same as everybody else is in the fact that we're going into where the community members are. We're going into the grocery stores, daycare centers, poultry plants in the area, into the school systems. The churches is a really huge area for our community. Housing, we've set up in apartment complexes because that's really where it's a safe kind of communal area for people to be. Gone into the hairstyle academy, into the supermarkets, into the industry, back to school events, daycares, Pepsi and car dealerships, anywhere where we can find a place where the community members are or we can get them enrolled. So we also have off-site the community liaisons, which I spoke about, on-site outstation eligibility worker to help with the application process, DHS in-house to review and assign the ARKids First, and then patient advocates who are not necessarily engaged in the enrollment process, but really going to find those children the specialty services they might need or help them walk through the medical competency they need to get the services that they're eligible for. We're going to evaluate our program by looking at how many kids are navigated through the application process, the number of processed applications, the number of successful enrollment, and then our final outcome will be how many additional new children are able to access community clinic because of their ARKids assignment. Our goals are to increase enrollment, to improve access to culturally competent primary health care, and address the development issues early on, and securing the continued health to adulthood. So we hope to enroll about 2,700 low-income Latino and Marshallese children over the next, we're going into about 8 months, so we'll end up after 2 years our project will wrap up. Thank you.